Minute after the hour, a little light rain and 53 degrees in downtown Sylacauga. We're joined this morning by CEO Glenn Sisk of the Coosa Valley Medical Center, our largest employer in our city. Glenn, good morning to you, sir.
Good morning.
Hope you had a wonderful Thanksgiving.
Yes, sir, did. Turkey and a nap. Always
there
good.
You go. A little
right?
Football in there, mixed in. And first of all, the state of the hospitals in Alabama in some areas is kind of frail. And talk about Coosa Valley Medical Center overall. Where are we in serving our community?
Well, your observation is exactly right, Jimmy Dale, and that is healthcare is in a fragile state in the state of Alabama today, most especially in rural communities. Recently, we see in Clay County where they're making a change to a rural emergency hospital, no longer having inpatient care. Just last week, the hospital in Greenville, down south of Montgomery, made an announcement that they're eliminating 90 jobs and moving to the same status. If you look across the state, there have been obstetrics units that have closed. So there are very few counties now, especially in rural Alabama, where babies can be delivered. So it's very challenging. At Coosa Valley Medical Center, we are very fortunate to have been doing this now for over 80 years. Had some fantastic people that have come before us that have laid the groundwork. As you mentioned, the largest employer now in Sylacauga with some 535 jobs, hoping to add to that number soon with some expansion opportunities. But we've got a great team of people led by our board of directors, our medical staff members, our team, our volunteers that really love the place, believe in what we do, and consider it a privilege to get to work there every day.
Talk a little bit about the services that are offered at Coosa Valley Medical Center at this point.
Well, we're in a little bit of rare air when I don't think about us, meaning Sylacauga, necessarily as a rural community, right. But we do have that status in the healthcare designation as a rural hospital. And what I would tell you is we're one of the top 3 or 4 rural hospital providers in Alabama in terms of volume. Today we're in about the 67th percentile of volume statewide. Now you've got some large providers, the UABs, sure. The Huntsville Health Systems, the infirmaries in Mobile. But as it comes to rural hospitals, we drive a lot of volume through the organization. As I hope your viewers know, that we do have a lot of services that in most communities our size, you have to go to a Birmingham or yes. a Huntsville or a Mobile. But we do offer those that you're allowed to stay close to home for care. And very important to make this point in that regard. If we make a decision, and I'll use our cardiac cath lab as an example. When we made a decision that we wanted to explore getting into that business, we measured ourselves with 2 things. One is, can we drive the same outcomes clinically that a Birmingham hospital can? And if the answer to that is yes, then we say, well, can we do so in a fiscally responsible manner? And if so, yes, we're in the business. In all seriousness, if we can't drive the same level of clinical outcomes that a Birmingham tertiary medical center can, we don't need to be in that business. We need to allow people to have care, access to care in those circumstances. So we take very seriously our responsibility in that regard.
The emergency room at Coosa Valley is probably the busiest of all the services provided, and sometimes with as many people as we have coming in, you have to balance this thing because it costs a lot of money for these services.
It does. You're exactly right. And to that point, we have about 24,000 visits annually in our emergency department. So
That's amazing.
It is a busy place. And we're thankful it's the front door to the hospital in many ways. We're thankful for our team of physicians there, our nurses and support staff that do a great job taking care of people, whether they're taken care of and discharged or taken care of and admitted to the facility. What I would tell you along those lines, Jimmy Dale, is we do have, unfortunately, quite a number of people who come to our emergency department mm-hmm. every day who don't have the ability to pay. This state made a decision not to expand Medicaid, and I don't want to get into the political sure. ramifications of all that, but it would have been a lifeline to people who need access to health insurance and in many ways to hospitals. Year over year, Coosa Valley delivers about $19 million in uncompensated care annually. So it is a big hill to overcome. It's a part of who we are. It's our front door. Our board believes in it. The state and the federal government says you've got to have an emergency department if you're going to be a hospital. Mm-hmm. So we're going to be in that business, but it does create a lot of challenges economically.
See a lot of success stories coming out of the cancer services that are offered at Coosa Valley Medical. Some great testimonials.
Absolutely. That group, under the leadership of Dr. Alan Yielding, many of your viewers will know Dr. Yielding and his team of physicians have been here over 30 years now in Sylacauga, and they have remained committed to it. Their main office is in Birmingham. They have a couple of others around the state. But they would tell you that this is one of the cornerstones of their practice success. And we have some great stories. We have a bell that's now been installed, and when people get to the other side of their cancer journey, they ring that bell, and we give thanks to their success, and we look forward to serving many more in the future.
You recently spoke to the City Council here in Sylacauga in the last week or so, and I didn't realize that mental health in the state of Alabama was in the state that is in. Talk about that a little bit.
It is, the circumstances are incredibly challenging. A number of years ago, the state of Alabama made a decision to get out of most levels of inpatient psychiatric care, which led to closures of state-run hospitals, which was certainly a challenge for the state. The decision at that point was, let's push mental health care, decision-making, and care into communities. And while that has great advantages, because we believe at CVMC that local healthcare decision-making is better than if it were made in Montgomery or Washington, D.C., however, our community was not prepared for that decision at that time, as most rural communities were not. So we made a decision a number of years ago to get into the adult or geriatric mental health space with our senior behavioral unit, where we have expanded that unit now once, moving from 15 to 20 beds. We anticipate with state approval we'll now move from 20 to 25 beds there. But we have a tremendous void with no access to care for adults. So the request with the state and with the City Council is for financial support that would allow CVMC to open an adult mental health unit that would bring 20 beds to Sylacauga to allow people to remain close to home for care, while financially being beneficial to the hospital. The challenge to make that work, however, is providing care to a medical surgical patient is very different from providing care to an adult mental health patient. So a lot of retrofitting, renovation work has to be done. And for us, Jimmy Dale, that number is about $2.4 million just to be able to take care of our first patient. Well, the financial challenges that we have says that access to capital creates barriers to care. So our ask of the city has been, we'd like your help in that. The city has today $2 million in their reserves that was provided to them in the 1995 transaction when the Baptist Health System took over the ownership and assets of CVMC. They have, as a great credit to them, they've retained that principal balance in place, have earned some balance or some benefit of interest. And what we've said as an organization, if they will allow us to have access to those dollars, that would be the seed money to help us get into the adult mental health space, we will remain committed to keeping them whole on the interest payments that they have enjoyed through the years, until which time that money is fully paid back.
How would this work? You know, if the money situation is satisfied, what are the steps to get this done?
Well, the state of Alabama says there's no need for inpatient mental health beds. We know that is inaccurate. So one of the things that we had to do was we went to the State Health Coordinating Council and asked for a provision to be changed in the state health plan that says, okay, Sylacauga, Alabama, CVMC, you can get into the adult mental health space. We were approved. The governor, Governor Ivey, has signed that document, and we're thankful for that. We do have one last meeting with them on December 17th in a few weeks. That would be the final step in that process. Assuming that everything goes effectively there, and we anticipate that it will, with dollars to help us begin renovations, we would anticipate beginning that at the beginning of the year. Along with meeting the need of mental health patients in our region, and not just here in Sylacauga, but when you think about sort of the five-county service area, to be able to bring people here, and it's not uncommon. Today, potentially, we could have an adult mental health patient show up in our organization, come to the emergency department. We do not have a bed available for them. We call Birmingham hospitals, we call Montgomery hospitals, no beds available. And that patient might be in our emergency department for 4, 5, 6 days. That's not the right place for that patient. The team of emergency providers, it's a challenge for them because their training is very different. So we believe that the need is great, not only clinically to take care of people in this region, but also financially it would be beneficial to the organization.
And mental health, it covers a broad spectrum. I mean, I see people on the streets in our city
Yes, sir.
that obviously have issues.
Yes, sir.
And they need care, but sometimes that care is not available.
You're exactly right. And as I've shared with our team, I shared with the council last week or 2 weeks ago. Today, if you go grab lunch at a local restaurant,
Yes.
you're likely to see someone walking the streets of our community that needs the sort of help that we're asking to be able to provide. To share a statistic with you, if you look at every 100,000 Alabamians today, state health planning says we need 50 adult mental health beds. Today in Alabama, we have 8 per 100,000. So we are hoping to meet a need in this community. We believe that we will do it very effectively. We have the physicians in place to do it. We will be adding approximately 25 jobs with the addition of the adult mental health unit. And we believe it will have a very favorable impact in the community.
Glenn Sisk, CEO of Coosa Valley Medical Center, our guest this morning. As this process moves along, if this is okayed with the City Council, which a lot of people believe it will be, certainly needed in our community, what is the process of lock and key of getting this facility up to speed with this?
Well, we've been doing a lot of work, sort of back office work, if you will, with architectural team, or an architectural team that has developed renderings. As I said, the care of that level of patient is very different from a traditional patient. So our team will be working very hard. We would anticipate generally that every bit of that work would be done by local Sylacauga residents. So the renovation work would be maintained locally, which is also very, very helpful. And we do expect that it's likely a 6 to 8 month scenario to get the space put in place. And how that really will work for us, if you look at our senior behavioral unit today, many of the viewers recognize that's in an older portion of the hospital, which we maintain very effectively. But the area that will be renovated will be the 3 West, which is above this, in the west wing of the hospital, above our 2nd floor med-surg unit. And there are a few reasons for that. One is it can accommodate 25 beds, and our senior behavioral unit will have 25 beds. Today we have a few rooms that are semi-privates in that unit, and that creates some challenges to get those beds effectively filled if you have a male patient and a female patient awaiting admission. Those can't be mixed. So the good news is we'll relocate the senior behavioral unit into the 3 West unit, which will be renovated, all 25 private beds, and then we'll retrofit the adult mental health into the senior behavioral unit.
And then the question is security. A lot of people, and there are people who are watching this morning who have family members that struggle with mental health issues, and they're not able to take care of themselves. Sometimes their mind kind of wanders a little bit. Talk about the security part of this.
Well, it's not uncommon today that on senior behavioral unit, for example, that we will have patients that have the need for one-on-one care. And what that means is that a nurse, a therapist, potentially a security officer is literally in the room with that patient 24 hours a day, providing that sort of intense care and support. Not only that that patient would unfortunately not create security risk for others, but to be able to protect themselves. And we have a very high obligation to ensure that the rooms are prepared in a safe fashion so that there aren't risks associated with a patient doing harm to themselves or to others. We certainly would anticipate full-time security being a part. From time to time, I think there is some sentiment in communities like ours that bringing mental health services to the community can create risk. To the contrary, we think it creates greater security because you're meeting that person at their point of need versus them walking through the streets of the community, potentially creating problems otherwise. So we feel very strongly that not only will it help limit the risk of damage to property and physical harm to others, we think it'll make a huge difference in keeping the community safer.
Before we go this morning, speak to our viewing audience of the importance of this proposal that you have shared with the Sylacauga City Council.
Well, we do believe that it's vitally important. You might even say that this is a crossroads decision in the future of CVMC. The organization, while it does tremendous work with our team members in meeting people at their point of need, delivers great value to the community to the tune of about $140 million a year in annual economic impact. The organization faces financial struggles that are real. And we want to do everything that we can to impact those things favorably. As a matter of fact, we recently had some external folks come in to evaluate who we are as an organization. One of the things that they believe very strongly needs to happen, that was at the top of their list of priorities, is the addition of the 5 beds to our senior behavioral unit, along with the 20 beds to our adult mental health unit. And that can only be accomplished with the financial aid of external folks who can help us, just like the City of Sylacauga and the City Council. So our appeal would be that hopefully this evening, that as we meet with the council, that they will strongly consider extending that $2 million for the benefit of CVMC and the patients that we provide care for, with the guarantee that that money will be paid back to them over time.
Glenn, always a pleasure. Thanks for coming by this morning.
Yes, sir. Thanks for having me.
Glenn Sisk, Chief Executive Officer of Coosa Medical Center, our guest this morning. More Daybreak just ahead.